let's go into what a pattern might look like if it was just hands and forearms, okay? Our back's gonna be really good and worked on. So, this hand, this is essentially what's happening. Just little pushes and pulls. That's all I'm sneakily doing to make this have more of a nice sensation. And I am curling my fingers a little bit, kind of more like this rather than this. Work my way down. Midway, we'd repeat that a few times based on time and preference. Swing around here. And it works really good. It's enjoyable. And then I'd say just do like 3 or 4 rounds of that on each side and then see where you're at time-wise in the real world, okay? Now, here, not this, not this, okay? Either off on the side and pulling stuff away from the spine if it feels like you can get a good enough grip and not be slippy. Switch. Here, here, here. Then if I wanted to get more precise, I have the soft fist to be able to work right here, more on the lateral side of the spine. If she's a case where it feels like I could deliver maybe enough force on the lateral aspect of the low back to feel like we were really getting something, like kind of more that therapeutic edge, quality of pressure. So that's where I could get a little bit more targeted there. Super round again. Same thing on this side. And we were working on arms. Hopefully I remember to bring my chair here. Put myself on a better angle. And that would be essentially all that's really available to you, right? Like trying to find other ways, it's just never going to be efficient. So that sandwich is going to be what ends up being the saver here. Switch. Yeah. At least the grass would muffle it. Right? Work our way. And then I could stay seated. I might get myself into a position where to get to the other arm right afterward. Right here. We went carpals to thenar, hypothenar, to metacarpals. To the phalanges. And it works awfully good. Okay. Then we repeat over on the other side. Get myself set. Scoot myself over. Interesting being in a island of chairs here. Okay. Kind of just going in speed here now. Here's a touch of a nuance with some of the mechanics that I use, and this is all, we're reaching a point where it's going to be a lot of here's some tips and tricks. I've got 3 versions of showing something and you pick which one works best for you kind of a thing. There are times when instead of needing like this, I'll feel like I'm applying more of a static compression and then I turn the body underneath that compression. Okay? That'll certainly have more intensity typically to it because I'm directly moving the jointed structures underneath my compression hand. But that's how I'll make that more than just the sandwich. I'll pin and grab enough of the proximal or distal area to directly. Works especially well, if almost specifically really well for the forearms. Because that's the joint that, that radius is what's actually doing that. So I'm replicating that action. All right, now we're almost through the stuff that we've already covered. So carpals, thenar, hypothenar. For selfishness reasons, one of the reasons why the hands tended to get neglected in these kinds of promotional settings is because it's just too much work on my hands, right? If it's shorter duration, but like you go set up and do that lavender festival thing, like no way. It would be real basic. It would be big squeeze, just finger squeezes. You got to think, 50 to 100 people out. So just don't, you got to be considerate and nice for yourself. Now we've covered that. Tacking on how you could find a way to work here on the legs and the hips. It's just going to be awkward. There's no way around it, right? You're going to be kind of crooked, all that. You can get yourself, try to be inventive, kind of spiral and pull. But I mean, I can get myself kind of set up in such a way. I know I'm blocking people, but I can get to the hips a little bit here. Way she already has herself positioned is frankly better. If you could just for a sec. That'll certainly shorten that more, but I like the stability of the leg out here. And when we come to the calves, this would be the better orientation for that anyway. So here I can just hold the knee. Soft fist would be the way to go. Up and down the quadriceps, I mean, it's only going to be the lateral aspect, but most people are going to talk about their IT bands anyway. So, I mean, it's covering an area that most people would feel like needs more focus. The hamstrings, yeah, either don't do it or try this kind of pull. But all of this is going to be a reason why I would say make sure you have your table there too. Because then maybe only, let's say it's even half of the people want the chair, right? At least that's less than. And it changes up how you're using your body. Calves. This would be better if it was, the tough part would be as if I was on concrete or grass. You're just gonna see getting this low, there's gonna be no way I can't be flexing up my spine in a weird way. But the goal would be, can we apply this kind of pull action on the calves? And so if I was able to be on a clean surface, it's actually easier because I can kind of drop down and get into kind of the side. This way. And at least I'm, for the most part, lined up better. But that only worked like if I was, I don't know, like at a hotel or something. But then you're down on the ground again. So it's all complicated. But you're stuck with this kind of pull action. And I mean, it's okay. If you're really trying to turn this into something, like you could just get a hydraulic something or whatever to get yourself set. But I mean, you can try, but boy, is that tough here. But just demonstrating essentially, what you might see in videos. We show some of it on the book, where you can get set in here. Down on the knee is certainly feeling the best for me, but I would be hard pressed to ever be in a position where I would ask for, like if I was having a massage clinic thing, asking the therapist to be working on the legs out of the chair. Now for the really big hack. The best thing I can possibly show you that is worth practicing, but as said, if it doesn't work good for you, then just defer to something else. It's an amazing thing. My trick is I always have my thumb right there on the spine, so I can be feeling what the spinous process is. That way, I can just put my shin right against the edge of the thumb. So I have my thumb like this. I know I'm right where I should be. Here, plant, and then there we go. Pressure okay? We want a little bit more, or is that good?
You could do more.
I might have to move a little bit down. You can tell me when it's good.
It's good.
I'm doing massage. Much easier. So you have to feel
like you have a fair amount of stability. Now, that's where you want to either really hold on to them and just hold on to those traps. I tend to go crossbody, and that way I can kind of just do these little pulls like this. And then I'll just hold that static compression for a good like 10 seconds, maybe a little bit longer, move my way down just a little bit. You don't want to be getting too much, you'll feel a little bit like the edge of the pelvis, of course, so pressure okay there? Mm-hmm. Okay. And then here. And then that point work, if I wanted to really sprinkle in something that's going to have a lot of sensations, where I can use the stacked fingers and kind of work here and give that area more of a targeted approach. But for the low back stuff, I mean, this ended up being a huge one. I would just go from that. I would be here, there, here, and shin, okay, pressure, good, there. And it saved my body so much. I can maybe argue, is it good for my single leg stability a little bit? Then just work steadily on that side of their neck or upper trap. The only thing I missed was talking more about the neck. It has been awful. Like her, we can work on her neck, but you're gonna have people show up that don't have much of a neck, and it's gonna be it's gonna be a journey. You're just gonna be there and you're like, where is it? Right? So neck work in the chair, it's difficult. Options for me have been everything from kind of doing more of this pull, especially up into the base of the skull. I'll kind of grab, and that's where I can use that stacked finger approach and at least get up into the base of the skull and work. That feels way more efficient to me than trying to push like this, right? If you can, like with her, we can create that curl and come over, and I can stabilize the head so I'm not turning her face in the face cradle as much. So that works okay, and watching out for necklace, not getting the necklace too much, right? Mm-hmm. So I can get my palms seated here for her and do kind of a push pull. That just isn't going to be available for most people, for all people. So the neck stuff specific, it's like I sometimes have seen people try this. I tend to err more on the using my wrist, my palm, to go up a little bit higher like this as we're doing the trap stuff, and then swing around, and we'll do kind of the head work here. And as a case where just like small circles, just because it'll feel good as I find where the base of the skull is, looking for those attachments. Now going all the way to the suboccipitals, but then I can get myself set. Kind of more of either letting it drift to one side or dual pull. There you go. Last but not least, this can be a good routine for, because we've learned a lot about the chest, but you got these things typically available. I can have you just lean right back against me. And then here's where we could, I'm going to bring your arms up, I'm going to grab underneath, and you could. Now, I haven't practiced this one a ton, but it could be a way to incorporate that kind of, at least open the chest wall, have them take some good deep breaths, right? But you want that barrier, right? Don't just put them up against your body. So, right. But you can have a person sit like this, and it's always a question though of how much work this becomes. You have somebody like this, let me get the barrier again. I can do a head massage, but it's all going to be a lot more effort. Go ahead and rest your. And that's what I like about this. I can even use it as like a pillow, right? So I can have her rest her head there, but then, maybe energy healing is where we can just do some long holds, right? hold the temporalis muscles in such a way that there's a little bit of tension being pulled. You can see how I'm doing a little on either side. But, you know, doing a full lift. I've seen people, and guess what, you know, if you can, go ahead and show off. But if there's somebody, you're at an event and there's another therapist over there just picking people's heads up and, you know, really putting themselves through a workout, just don't do that just to keep up with them, right? So, all right. Now what do I do as she tries to get out? Do I step away and start thinking over here? No. So, all right. We'll go ahead and let you get out. Sure, nice and easy. Yes. She did that very gracefully, but you can see where that's the more cautionary component.